So today let's talk about the RBCs and specifically the deficiency disorder of RBC, that is anemia. So before we can talk about what anemia causes and what it actually is, first let's try to break down this word itself. So here we have A as a prefix and emia as a suffix. So A here means absent, and the suffix emia means blood. So what is absent from the blood, or what is deficient in the blood? That is RBCs, right? We have less RBCs than normal in the blood. So we actually define anemia as reduced RBC mass in the blood. So that's the formal or technical definition. So now, why do we even need RBCs, right? So here we see that there is a deficiency disorder named anemia for the RBCs, but why do we actually need them? So to understand that, let's begin our journey from the very beginning. So we are taking air into our lungs we are taking actually oxygen from the air into our lungs, and the oxygen actually is coming to the vasculature or the vessels, blood vessels of the lung. And in the vessels, as we know, there are RBCs floating all the time. So this oxygen molecule will be diffused into the RBC, and as we know, it will complex with the hemoglobin molecule, and now this RBC will transit throughout the body into the circulatory system. So the pulmonary veins will take this RBC back to the heart. So this will be our left atrium and this our left ventricle. So the blood will from the left atrium come to the left ventricle, and from the left ventricle it will go to the systemic circulation. And what will happen in the end? In the end, the blood will flow to every tissue there is. So let's say this is a tissue and there are some cells. So the oxygen that we took from the air and that was carried by RBCs throughout the circulation now will diffuse into all of these cells of a specific tissue. And what will happen inside of it? We will get respiration, rather internal respiration, and the product of respiration using the oxygen will be ATPs. So this is our end goal, to produce ATPs so that these ATPs, that is the energy source of our body, can be used in the tissues and the tissues can function. So what's exactly the RBCs are doing? The RBCs are taking the oxygen from the air and they're supplying it to the cells of the tissues, and inside of the cells, that oxygen is being used to produce ATPs. So that's the role of RBCs in our body. So now that we know why actually we need RBCs in our body, that is to produce ATPs, so think about it. What will happen if we don't have enough RBCs in our body? We're actually naming it anemia, but is a name really important? What's important is what's actually going to happen to a person who is anemic. So if there is reduced RBCs in the body, we will see some classic presentations of that. And first one would be fatigue. So the patient will complain of feeling weak, especially the patient can complain of feeling weaker than before. Why is it happening? Why is the patient fatigued now? Because let's look at here. So we see RBCs were carrying oxygens and we were making ATPs in the cells, right? So now RBCs are less, or they're dysfunctional, or in some or for some reason or another they are not being able to carry oxygen to the cells. So what's happening? ATPs are not being produced, and if the cells are not getting their proper energy, what will happen? They will not function well. Imagine you're trying to run, let's say you're trying to exercise, but your skeletal muscle is not being able to produce enough ATPs because your RBCs are not working properly, or your RBCs are not even present in enough amount in the blood. So you are feeling fatigued for that reason. So what does this word actually mean? So dyspnea actually means an awareness of breathing. So when we're not aware of breathing, still our lungs are taking air in, right? Our diaphragms are working, our respiratory muscles are working. But when we're aware of the breathing, and that is uncomfortable, right? So an uncomfortable awareness of breathing is known as dyspnea. And why is it happening when we have anemia? Because again, the the RBCs are not being able to carry the oxygen to the cells. So what's happening now? Let's look at the blood. So what's happening in the blood? So in the blood, we have less oxygen than before, right? So what's happening is the brain is trying to compensate for that. So the brain is giving signal to the lungs to take more air in so that we can make up for the reduced oxygen supply that is happening due to reduced RBCs. So we are actually trying to breathe more to get more oxygen in so that our tissues can get more oxygen. And that is the basis for dyspnea here. Next up, we have a cardiovascular symptom that is palpitations. So patients actually complain that they are aware of their hearts beating. So again, it's more or less like dyspnea, that they can feel their heartbeat, and we can't feel that normally, right? So palpitations is actually due to an increase in the heart rate. So why is the heart pumping more frequently than before? So the RBCs are not taking oxygen efficiently to the tissues. And what the heart can do here is, if it pumps more frequently, the RBCs, well, what's happening here? The RBCs are coming to the blood, coming to the heart, and the heart is giving RBCs and the oxygen to the tissues, and tissues are again giving back the oxygen to the heart, and heart is again sending it to the lungs, and lung is sending oxygenated blood into the pulmonary venous circulation. So that's the whole circulation. So if we have less amount of RBCs, and the RBCs, now if we pump the heart more, if it pumps more, then the RBCs will transit through the circulation more frequently, so they will have more exposures to the tissues and cells here, so the cells can get more oxygen, even if there are less amount of or less number of RBCs present in the circulation. That is, if the patient has anemia. So palpitations is also a compensatory mechanism. So far, we have had a general symptom that is fatigue or weakness. Then we had a symptom of the respiratory system, and we had a symptom of the cardiovascular system, right? So now the most important system, that's what we will discuss now. So the system, when we're talking about RBCs and oxygen, that should come to our mind the very first time is the central nervous system, specifically our brain, because our brain is the most oxygen dependent organ. Actually, even if it's not the most oxygen dependent, problem is it cannot go without oxygen for a very long amount of time. Actually, it has only 5 minutes before all the neurons in the brain start dying. So the cutoff point for brain necrosis is very low. So we can say that the brain is very much oxygen dependent. So obviously we will get some symptoms in the brain or in the central nervous system when there's anemia, that is when there's less RBCs, therefore less oxygen. So what will be the symptoms of the central nervous system? First up, we will have headache. So that's the first symptom in the central nervous system. And next up, we will have lightheadedness. So the patient will complain of feeling sort of lightheaded, and there will be a tendency for syncope. Patient will actually not be unconscious, but the patient will feel like they're feeling lightheaded more often than not. And why is that? Because it's very intuitive that the brain is not getting appropriate amount of oxygen, so the neurons are not being able to function properly. That's why the patients are feeling lightheaded. So I hope we are clear now about the classic presentations of anemia, that the patient will come with fatigue, the patient will have dyspnea, and they can have palpitations, lightheadedness, or even headache. So these are all the classic signs, symptoms that an anemic patient will present with in the clinic. And remember, the initial diagnosis has to be based on these symptoms, right? You will not get a let's say CBC or even iron profile or any higher level test. You'll not get those at the very beginning. So if any patient, let's say a patient from the cardiovascular ward or a patient from the respiratory ward, whatever the subspecialty of the patient, you will have to always look for such a common disease that anemia is itself. So these symptoms are very important to remember, and also it's more efficient if you remember with the explanations that I gave you. So that will be all for this video, and in the next video I will talk about how to actually quantify anemia. That is, how to understand the values of the RBCs in the blood and then interpret those values and diagnose anemia. So those we will talk about in the next video, and until then, keep learning and stay sharp.